So there's a lot of really exciting innovation going on inside the NHS, much of it being driven by the new care model vanguards. I think we've tended to focus quite a lot on what we would describe as vertical integration, which is bringing together primary care, social care, community, mental health and acute hospitals in a single area. And I don't think we've concentrated enough on the really interesting things that are going on in terms of horizontal integration, where providers of the same type are working together across a broader geographic area to do some really interesting things. And that's what this report concentrates on. There are three reasons as to why providers are collaborating in a horizontal way. First of all, what they're looking to do is improve their efficiency. So what we've got, for example, is acute hospital trusts sharing back offices. We also know at the same time the NHS is facing some real workforce challenges. So there are some real opportunities when trusts work together to tackle some of those workforce issues. So for example, one of the acute collaboration vanguards has done some really interesting work around creating a single bank of staff that can be shared across all of the trusts, and done things like creating a training passport. So if you've trained in one trust, you can go and work in the others. The third and perhaps most important reason as to why people are doing acute collaboration is to ensure care quality. And for example, it means that if you take Moorfields, which has got world-leading expertise in dealing with eye care, then they're able to bring that expertise right the way across a wide range of different trusts. So what the report also shows really interestingly is there's three broad models of acute collaboration. The first is, and I'm here in the Royal Free, which is my local hospital, is the group model, where effectively a number of trusts kind of come together in a single group. A second model is the model that people like Moorfields have pioneered, which is it's a single specialty network where effectively you're just concentrating on one specialty and making that expertise available across a wide number of different trusts. And then you've got a third model, which effectively is multi-service networks, where effectively you've got groups of trusts, like for example the group up in Sheffield, which has got Barnsley, Rotherham in it, who are working together across a range of different services. They're all really interesting different models, and I think the report really brings out the pros and cons of each of the different models. So we spend a lot of time talking to hospital, community, mental health and ambulance trusts, and I really would commend this report to everybody. I think it's a really interesting report that any trust, any leader in any trust will be able to get a huge amount out of.